In today's Your Healthy Family, we're talking about some of the newest treatments available for postpartum depression and drug-resistant depression.
But the good news is that there are now many options for women with postpartum depression. And I think each woman and each family and each doctor is going to figure out which ones make the most sense for their particular situation.
The two latest treatments to get FDA approval are called Zulresso and Spravato. Zulresso is a hormone-based treatment and is the first drug specifically developed for severe depression after childbirth. It requires 3 days in the hospital to be administered and was approved in March.
Hormone-based treatment that will be a 60-hour inpatient IV infusion. This treatment shows lots of promise for helping women get better in the short run. It is, of course, time-consuming to be in the hospital for nearly 3 days and be hooked up to an IV that entire time, and you're doing your child care in the hospital and all of that. But very good results within 4 or 5 days.
Spravato was also approved by the FDA in March and was fast-tracked by the FDA as part of the first new class of antidepressant drugs in more than 3 decades.
The Spravato S-Ketamine also requires that you go into a clinic, but you have to do it twice a week for a month, and then once a week for a month, and then every other week for the rest of the time that you are suffering from depression.
Spravato is a drug that's related to ketamine that's been used off-label to treat severe depression for years.
The FDA approval of Spravato, or S-Ketamine, a nasal spray of half of the ketamine that we usually have. Usual ketamine is 50% S-ketamine and 50% r-ketamine. The nasal spray is the S-ketamine only.
For postpartum depression and drug-resistant severe depression, TMS and ketamine are two other options. TMS does have FDA clearance. Ketamine does not, and we've detailed patients' stories who've used both treatments previously in Your Healthy Family.
And both TMS and ketamine infusions have been used historically for depression and postpartum depression. They are off-label rather than on-label. But nonetheless, significant literature in the case of TMS since 2008 in its use in postpartum depression, and in the case of ketamine, certainly since about 2013, give us a high degree of confidence that these are reasonable options as well.
As effective as these new treatments have been, and they are all available here in southern Colorado, getting insurance companies on board is often a more complicated and time-consuming process.
We don't know how long it will take insurance companies to get on board with that FDA approval, because each individual insurance company makes their own decisions. It takes 4 to 5 years to get FDA approval, if they get it. Once the FDA approval happens, it usually takes between 2 to 4 years for the treatment to come into general use. That doesn't mean that some people don't have the opportunity to use it pretty quickly, but things move slow. I don't like that, but I'm enough of a realist to know that's what tends to happen. But if an individual patient had a serious interest, and I've already got several patients who have serious interest in either one of these treatments, then we're going to push hard and devote energy and time with insurance companies to try to get it approved.
I'm Ira Cronin. For more health stories, head to yourhealthyfamily.com.